Well, it's 9 o'clock and I will call the meeting of the Neighbors of Dunn County Committee to order. And I see that Supervisor Bjork, Supervisor Witzel, and myself are here. Is Don on Zoom? Okay, he said he was going to be.
Okay, he's not, and neither is,
Sean Breslin. Okay, three of us are here. We have a quorum, so we will continue. We didn't meet in July, so we're approving the minutes for June. Okay, we have a first and a second from the two that are here, and all in favor? I assume there wasn't gonna be any discussion. Is there any public comment? Would you like to sit up here, Steve, so you can hear better?
That's all right, sure, thank you. Well, the acoustics in here are pretty good.
Well, it's difficult for everybody to hear back there.
Thank you.
All right. No public comment. Number 5, at the request of the chair, there was none. Although next time you can actually put the CNA training course right there if you want. And number 6, report of the neighbors fiscal year 22 audit.
so this will actually be deferred to next month when we talk to the auditors. After the agenda had already gone out, they were not prepared to come this month, so that'll be deferred to next month.
Okay, thank you. And then, of course, that puts you on, Carmen.
First, as always, we have our quality assurance steering committee updates. So we've had 2 meetings since our last meeting for this committee, nothing outside of the norm. We've been doing a few policy updates and also doing a few things to get rid of some dual work that people have been doing if there's 2 assessments that cover the same thing, just really cleaning up a couple of processes. So that's been the majority of the work for QA meetings, changing policies, making sure everything is up to date, and going through that. But nothing earth shattering through that committee recently. Any questions on QA?
Doesn't look like it, so let's go on to employment activity report.
All right, I'll start with Chris for that.
Morning, can everybody hear me?
Yes.
Okay. So this covers obviously June and July. So we go through the types of recruitment, which stayed pretty much the same. We did a Facebook push that was a little out of the normal. So number of direct hire interviews, we had 16 interviews during those 2 months. Positions offered were 4, positions accepted. I think because I have my numbers wrong. Positions offered were 15, positions accepted were 13. And positions offered at higher than a step 3 were 3. We're able to hire 3 nurses. Then we did have 7 resignations. Pretty much it was college graduations and moving away school type schedules, that type of thing. If we go down to open positions, those would have been adjusted by the amount of agency that came and gone and the hires and people offboarding. We go down to work comp lost hours. We did not have any again for June, July, so that's always a good thing. If we go down to number of hours missed due to COVID for June and July, roughly 50 shifts, a combination of 8s and 12s and whatnot, equaling out to be approximately 475 hours, which includes agency staff. And that concludes my piece of the report.
Question here, Supervisor Bjork. And just remind you so that they can hear us better, really speak into these.
Okay, on COVID-19 issues, so how far does that extend from the people that actually come to work? Is it like if they have a relative or they were at a meeting with somebody, or
So
What's the policy on that?
it
And I'll
depends.
defer that one to Carmen. That's not my specialty, so.
So it depends on the situation. If someone this total is for anyone who called in sick that had to either be tested for COVID due to having a symptom, if they were a close contact and then had a symptom. Right now, the policy is not that if someone is a close contact that they're automatically restricted from work. It's only if they start having symptoms of COVID. So if they have a symptom of COVID or if they test positive from COVID, that's where this number comes from. We're doing internal testing. So if say a staff member calls in today because they have a sore throat, we have them come into the facility, get tested, send them home, so that they don't have to get tested in the community anymore due to the cost of that. But this number is just people who either were out with COVID or had to miss due to being COVID tested. So if you're a close contact, unless you have symptoms, you're not restricted from work.
Okay, say that again.
So if you're a close contact, so that would be, so if say someone in this room had COVID, found out the next day, I could still go to work unless I had symptoms.
Okay, let me ask through a different way.
Mhm.
You have a child that goes to school and somebody in the classroom tests positive with COVID,
Mhm.
and then your child comes home. How does that affect you at the neighbors as the
It
employee?
wouldn't unless you had to stay home due to childcare.
Oh, okay.
So like they wouldn't be required to stay home from that situation, but if they had to due to childcare because their kid was sick or had to stay home, but they wouldn't be restricted from work.
Okay. And if a person doesn't come to work because of childcare or
Mhm.
because of COVID, they get as many paydays as there are, or how does that go? I
It
mean,
would depend on their employment status. So if they're a full-time employee and they have sick days available because of what they have in their leave bank, then they would have those covered with sick days. If they're a part-time employee, they would not be paid.
okay. Well, I didn't realize that the COVID issue thing was still an issue, I guess, but.
Yeah, so it still is. There's still, we have actually, I guess it would be later on in the report with COVID, but
Do you want to do it? Do you want to do it now?
I can, yeah.
Without objection, we
Yeah.
can include E.
So COVID has actually had a fairly large spike in the last couple of weeks or month across our community as a whole, across the state, and I believe across the country. There's been a new variant as well as people are just getting sick again. It's not to the same extent where we have lockdowns or anything like that. But if someone does have a COVID symptom, we are required to exclude them from work pending testing. If someone tests positive for COVID, they still have to be out of work. In the last month or so, we've had 5 positive residents across campus and probably around 10 positive staff members. So it is still a thing. We still deal with it every day. If a staff member tests positive, we still are required by CMS to test all the residents that they had contact with. And then that's the same for if residents test positive, we are required to test their household. So of those residents that were positive, the majority of them were in one household. We had 4 residents test positive within a week of each other, all in the same household. Based on one resident having symptoms, we tested that resident and then subsequently had to test all other residents, and there were other positives as well. So it is still a thing. And we actually did have one resident pass away of COVID from that outbreak as well. So even though it's not considered a public health emergency anymore, it is something that in the healthcare world we still deal with every day.
Is the masking requirements for COVID different in, I thought at one time I had heard that they were different in your type of facility versus a hospital.
Yep. So we are required to wear masks in the case of an outbreak. So if we have a household that there is one positive person, whether that be staff or resident, we are required to wear masks for 14 days. And it's 14 days with no new positives. So if one resident tests positive today, we'll have to wear masks for 14 days. If another resident tests positive tomorrow, that 14 days starts over. So it's 14 days with no new positives. So that would be staff and visitors have to wear masks during that time frame per CMS. Outside of outbreaks, we are not required to wear masks anymore. So if the household isn't in an outbreak, we don't have masks. And then whenever an outbreak occurs, if someone tests positive, we notify families that masks have to be worn in that household. And then also staff are notified and then masks are available.
Thank you.
Those, they really filled in a lot of information, and that's good questions. When you tested some of the residents, did some of them no symptoms? Yeah.
The majority of them had no symptoms. It started with one resident having symptoms and then tested that resident. And then when we tested everybody else, there was 2 others the next day and then one more the following day. One of the other ones had very minor symptoms. Once she tested positive, she was like, oh yeah, I guess I feel a little off, but that was about it. The other ones had no symptoms.
Were all 5 residents in the same household?
4 of the 5 were. The other one was actually a situation that we had someone come to us from the hospital and we test all residents upon admittance to the nursing home. Because if they are positive with COVID, we want to make sure that they are isolated right away. And we had a resident that was admitted to us in a different building than the outbreak that when they came to us, they tested positive the first day they were there. So we had previously been requiring the hospital to test people prior to coming to us. And then the hospital had told us we were one of the only facilities requiring that and that they didn't really like that we required that. And then about a week after we stopped requiring it, that happened that we had someone come to us with COVID. So we are now requiring the hospital to do that again.
So is the variant about the same as what COVID originally started out with as far as symptoms? Are they pretty much the
Yeah.
same?
So the list of symptoms per the CDC website has not changed. So I don't know if there's specific ones that this variant is more commonly showing, but the list of symptoms that the CDC considers a COVID symptom has not changed. Any other COVID questions at all?
No, it doesn't look like it. So let's go on to,
The resident referral?
yes.
Okay. Resident referral report. So at the beginning of August, we had 101. This would not be August. This is the wrong date or month listed on here, but we had 101 residents. We had 134 referrals over the 2 months of June and July. So this is a 2-month report. We had admitted 23 residents during that time frame and did not admit 111, excuse me, residents. We ended the month with 103, and as of today, we're at 104. Which is pretty much full with having 2 households closed at this point. We have very few open beds. It's just the only openings are due to turnover of residents. So we are remaining as full as we can be with the 2 closed households. We had 2 residents transferred to other facilities. We had 3 residents pass away and we had 11 residents discharge. So right now we're basically, like I said, doing turnover beds. So someone discharges as their short term or we have someone pass away. We're cleaning that room and having someone in the room fairly quickly because we do not have any other open beds besides our 2 closed households. We do plan on looking at opening Fireside in September. Based on Chris's report, if the staffing report and employment report, we have had several direct hires in the past couple of months. We were fortunate to have a few people come from one of the closing nursing homes in our area, which was a great benefit to us. And then we have had some people come from Mayo recently, and we have had a couple of return employees as well. With return employees, that is wonderful because it takes a lot less training as well, as they've already worked with us. They know our systems, no matrix care. So we do train them back in, but it takes less time frame to get them up to speed and working independently. So we do plan on opening Fireside in the next couple of weeks. And to start, we would not fill that household completely full. So we would have it so that we only need one additional CNA or nurse in that household. And we would try to admit people that aren't needing 2-person transfers and things like that, so that staff can manage without it being completely full. So that process, if any of you remember from a few years ago, of opening a household, is a little bit cumbersome because we don't want to admit one person at a time, because then we have one staff member taking care of one person. So that's not A, fiscally responsible, and then B, also not good for the residents. They do enjoy having peers in their households. So we don't want someone to be isolated in a unit by themselves. So we typically try to admit several people in one day. So when that does occur, it'll be a busy couple of weeks.
You mentioned, not our last meeting, but June meeting, that you were looking at temp agencies from like Nebraska and Alabama. Are you all done with that, or what's happening with that? Any more that you got from there, or nothing, or what's?
So almost all of our agency employees are from out of state. So they're kind of all over. We contract with a temp agency or an pool agency through Nebraska. So they're in Omaha. The agency that we contract with, that's just where their central office is. That doesn't mean the staff come from there. So there's local staff that agency staff, semi-local, I mean, kind of in the Midwest, that work through there, as well as people from down south. I would say most of our employees are from southern states that are through agency, but some are from Minnesota or Illinois.
I was gonna ask, is they like Twin Cities area or just anywhere in Minnesota?
Kind of wherever. We see where they're from based on their application. When they, we have to have all of their information. We get the copy of their driver's license and things like that for HR practices. But most of the time they're from kind of all over. Sure. So Chris asked about Elmwood. So Elmwood Nursing Home was managed by Grace Lutheran Communities. So Elmwood is, as everyone knows, pretty close to us. Grace Lutheran Communities is who owns or manages ALH here in town as well, and also managed Pioneer in Prairie Farm. They announced their closure about a month ago now. As of last Friday, I talked to the ALH administrator, and they had 3 residents left at Elmwood. That is where we have gotten some of our staff from that have come our way in the past couple of weeks. And we have admitted at least 1 resident from there. I think that was all we had space for at this time. But so that's another local nursing home that has closed its doors recently. So in our general 30-mile radius, Prairie Farm, Colfax, and Elmwood in the last year have closed.
Okay, so you don't know about the one from Altoona that closed up?
The one from
I thought
Altoona.
there was one from Altoona or Claire someplace that closed up.
Not this year. Fall Creek closed quite a while ago. Altoona has a couple of nursing homes. Part of Prairie Point, they dropped from 2 licensures to 1, so that
Okay.
might have been it.
Okay.
That's also Grace Lutheran Communities.
Okay.
So when they opened, they had a bunch of licensures, ranging from multiple kinds of nursing home, assisted livings, all different kinds of licensures, and they've just kind of changed that around a little
Okay.
bit, but they still do have
Okay.
a nursing home.
Okay.
Do you have any idea how that bodes for ALH here in town?
I do not. I think ALH, so they are managed by that company. They aren't owned by the company. So I'm not sure what the plan would be for that. So they are owned by Lutheran Communities and then managed by Grace Lutheran. So they hire Grace Lutheran as a management company. I've not heard anything else about any of Grace Lutheran's other properties if they are planning on closing any more. I would doubt ALH would be on that list, but that's just my assumption. They've been around a really long time and Grace Lutheran has been managing them a really long time. Both Elmwood and Prairie Farm were managed by them more recently, so.
Any other questions before we move on? Okay, is Scott online or are you gonna do Scott today?
Scott is there. Looks like he is. Scott, are you? Well,
I am here.
okay.
Sorry, just trying to get things going here. Well, good morning, everyone. There, I have everything working now. Working remotely this morning. Since our last meeting was June, a lot of stuff going on, work order wise, grounds care wise, general preventive maintenance through the buildings. Brady and Bob have been doing a great job. Some of the other guys have been over to neighbors also to help out in a few situations, but things have been going very smooth. Brady's doing a great job on keeping up on everything for the state regulations and stuff. He put together a policy and procedure for the Legionella testing so that we have that covered for state. They've been asking about that on surveys. So we got that covered. Otherwise, things have been going fairly smooth over there for as far as facilities. Custodians are doing great. Things have been going smooth.
You have something, Carmen?
Yeah, the only other thing I would add is the only thing we've had troubles with recently is with the very hot weather. Our fire system picks up on the humidity and the temperatures of the hot weather in some of our vaulted ceilings. So we've had a little bit of issues with that this past week, but Brady's been working on that as well to make sure that we don't have fire alarms going off and the local fire department isn't dispatched to us because that's happened a couple of times. So they've been working on that. It's a good thing that our fire system is that sensitive that in the case of an actual fire, we know it'll work. But unfortunately, with how hot and humid it's been, it's caused a little bit of trouble, which it has in past years as well. But just an FYI.
Yes, the humidity really affects fire alarms. Brady was telling me that fire trucks were dispatched to mail for their system on a false alarm. I did see on social media that multiple calls were put out for fire trucks to come, and then when they were en route, it was canceled as was a false alarm because of the humidity on the system.
Supervisor Bjork, did you have a question?
Yeah, question on the fire trucks. In the townships, it costs $500 to have a fire truck get out the door to come and see you. Are you guys charged anything?
Not to my knowledge. I don't know if Scott, if you see
Then we won't
that.
ask anymore.
Well, we have not had any dispatch to us on a false alarm. Luckily Brady has been on top of it and has got that taken care of so that they haven't been dispatched to us.
Yeah.
Thanks, Scott.
We had one day that one of the battalion chiefs happened to be in our neighborhood when he heard it, so he just stopped by, but it wasn't like an actual dispatch. He was just in one of their trucks, but he was wondering if there's something that they could do to help fix the system, and it's just super sensitive to everything, so.
Okay, it's always nice, Scott, when you have a very short report. That means things are going well.
Things are going well. Thank you.
And we did E and now F, East Complaint Survey.
Yes, so this is, we had actually 2 East complaint surveys in the past couple of months. So we had one the first week of July, and then one just last week. So they're actually, we can talk about both of them. Neither of them were actual complaints. They were self-report surveys. So anytime that we do a self-report about any sort of situation that requires us to report something to the state, they can come back and look at them as what's called a self-report survey, but it falls under the complaint survey bucket. So this is a survey outside of our normal survey window, and they can come in whenever and they just look at that specific thing. So they don't do a full certification survey, and if the survey is about something to do with medications, they don't go and look in the kitchen. So it's just about that specific thing. Both of them were about self-reports, like I said. One was actually about 2 self-reports, and then the other one was about 1. They said that in all 3 of the self-reports that there was no issues. They actually were quite confused of why they were dispatched to us. It's something that we are working on with the state survey team, as well as with Leading Age. I brought it up to their attention because there are things that in the past we never would have had surveys related to, as well as when the surveyors got there, they were quite confused of why they were there. There was nothing listed as a problem or an error or anything like that. And then they were dispatched to us and there for half a day and gone. So it seemed kind of like a waste of their time. It's definitely a stressful thing for our staff when they come in, as well as it is time consuming when they are there, as well as that it's just time consuming across the board for them, us, and they don't know why they were there. So we're trying to look into that if there's something that's changed in some dispatch regulation with them, because it has become a thing. The first survey, when they were there, they said that this was the first time that that had occurred. And then when the surveyor was there the second time last week, she said this is becoming a thing kind of across the state. So she doesn't know if the dispatch team in Madison is getting more picky on things, but she said there was nothing listed as a reason to be why they were there. So all in all, the surveys went well, so we're not concerned with that, but it is an added thing and added work for everybody without seemingly a purpose. So, but we are now prepared that that's going to be the case almost every time we file a self-report, that we might see surveyors within a couple of weeks. So both of these were situations that happened a few weeks ago, and then they came in within 10 days of the self-report being filed. Any questions about that at all?
It looks like we can move on then to 8, review of vouchers and financial reports.
All right.
Is that Jane? Oh, I
Jane is
see
here.
Jane.
Hi. And I'm remote today, and it's good to see you all. I'm going to try to share my screen here, if we can. Host disabled participant screen sharing. So Carmen, you're going to have to allow me to screen share. Or whoever the host is, if it's Chris.
It's me. I'm getting there.
Okay.
It's not coming up as an option. I don't
Well,
do
we can test it next time, or we could just keep going forward while you look at it, because everybody has their vouchers. Are there any questions on the vouchers? No questions?
Supervisor Witzel,
now she should be able to.
and I've got to admit that I didn't find them in time on my computer, so.
Okay, I reviewed them and they don't look out of line. It looks like everything is, going along as normal, and things are getting processed timely. Okay,
Jane, I made you a co-host, so you might be able to now.
okay, now I can. I believe. It says I'm sharing.
Yep, it looks good.
Okay, I can't see it, so I'll have to trust you. You can see the campus census.
Yes, if it could be just a hair bigger, it'd be helpful, but,
Okay. Um, like
oh,
that.
that's great.
Okay, so the census was great. We almost made it to the magic 94% in one of the buildings. I call it the magic 94% because that's when we can start billing for Medicaid bed holds. So internally, I have a little goal of the census uh, numbers as well. The veterans was good. Of course, the private pay is not as we had hoped, but Medicaid nights are right up there too, and so is insurance and Medicare Advantage. So yeah, it's looking good, and Medicare numbers look good compared to budget as well. So that's what I look at with those numbers. Any questions?
It doesn't look like it.
Okay. The aging, I'll make that bigger. As of July, the blue is our current aging, and then as it gets older, it gets orange, gray, and blue. And that was a little higher at the end of July. I think because we had a lot of Medicare in this month, and then the coinsurance comes up in the next month. So that should reconcile itself. It's a little higher than the previous month, but hopefully we'll get that back down. Any questions on that?
Yes, Supervisor Bjork.
Thank you, Mr. Chairman. I know I should be able to figure this out, but I just have to ask the question. You know, we're talking about dollars and cents here. Aging has nothing to do with the residents. It has to do with accounts due, I imagine.
Yes, and how we bill. If we have a high Medicare month, we can't bill that till the end of the next month, and then the coinsurance is the month after that. If there's more money due, it's the month after that. So we are restricted in collecting funds based on the payer source as far as the timing. The private pay, of course, comes through much quicker, or it ends up in the collections. So
So this tells me in July of 23 that we have a million 440.
mhm.
Anyway, is that the amount due to Dunn County?
Right, that's the current amount due. If we made everybody pay Medicare and all those places pay today, that's what we would have due to us.
Okay, and then how does that coincide with the 95% Medicare, 94% Medicare billing?
That,
Connection with that?
oh, no, my 94% is just occupancy. My little
Oh, that's just the census.
my
Census
census, yeah,
of
my little
Medicare.
internal not game, but my little goal, yeah. So
Supervisor Bjork, the only thing that would coincide with that is that the higher census, the more money that would be in receivables just because we've billed more. So that's the only, if we have a higher census, there'll be more money in receivables, primarily because of Medicare, because normally when our census is higher, it means we have more Medicare residents and it takes longer to get the money from Medicare.
Okay, now another simple question. If your Dunn County is owed almost $1.5 million for payment, do we receive an interest at a certain time when that count is not paid by somebody? Or do they get the not pay us for free?
depending on each claim, if we've submitted a clean claim and they just haven't processed it timely because they're backed up, then yes, we have gotten some interest. Not very often do we get interest. Generally, the aging is because of the different payer sources, and one pays first, then we have to bill the next one, then the next one. A lot of times there's 3 different payers on somebody's claim. So it takes up to 3 months just if we're right on the ball and get things done quickly and things cross over automatically. 3 months is a good thing. If something gets stuck, it could be 4 months before that claim is completely done.
Got it.
Yeah, and we don't bill weekly because skilled nursing facilities aren't allowed to do that, like hospitals are. We have to wait till the end of the month and then bill that whole item out. So if somebody discharges on the 2nd of the month, we still have to wait till the end of the month and about the 10th of the following month to actually bill that. S-
Hmm.
So maybe that's more information than you want.
Well, no, that was great. And looking at the bars, we're really looking at the top 3 colors. If we can keep the top 3 colors way down, that means,
Yeah.
yeah, okay.
Yep. So, yep, that's the oldest stuff. The current stuff is good. We're working on that as long as those get down. That's good. But yes, those top colors, the green, blue, and light blue, there are what we want to minimize. And that shows you that my staff is doing all they can do to keep that down.
Thank you.
So Jane, just curious, where did the VA, it takes longer for them to pay, so where do they fit in this July bar graph here? Or do they fit at all?
Generally the orange to gray,
Orange-
usually in the gray, because we get their payments. May and June services are just paying now, so
Okay,
they pay a little bit longer.
okay.
Yep.
So at least a couple months out at least.
Yep.
Yeah.
Yep.
Okay, thank you.
Mhm. But we do get paid, so they're the ones that would pay interest.
Yeah.
So, yep,
Yeah,
okay.
these questions really help me understand the bar graph better. That last one, I just hadn't thought of that. Where do you put each one? Yeah, that's interesting.
Yeah.
Thank you, Jane. Next up.
Okay, next up would be the financials. Are these big enough to see on your side?
I can, or
Okay.
we're okay.
We
Yeah,
also
here.
have some print off copies too.
Yep. Okay, so these are the January through July financials. And according to budget, now again, we did budget for a full campus, fully open campus. So our budget is due to projected, it's a little bit off. But intergovernmental, we don't know. We're from July through the end of the year now, we'll be kind of doing our best guess at the supplemental payments because the state hasn't quite determined what the amount could be, or even the ballpark amounts. And Carmen knows more about that. We can talk about that during the next year's budget when she presents that. But we're hoping for this much money. Again, that's very fluid. Public charges were down about $1 million from what we budgeted. That should start looking better when we open up the new fireside unit. Miscellaneous is, again, it is the senior meals and land rent, that kind of thing. So that's a little bit off too. There's no bistro, there's no revenue there. Of course, there's no expense to match it either. So in the end, it nets out. Interest is what's booked from late accounts, like private pay accounts. And that's fluid as well. It is a good tool that we use to inspire people to pay their bills. Not meant to be a revenue generating item. Donations, we budgeted the van in here as a item, and we also put it in as an expense. It's not in the projected right now, but we do have $67,000 that's available in donated funds for us to use for the van.
And I'll also add the 67 and then with an additional roughly $6,000 from the golf outing.
Wow, we're there. Great. Agency staff expense is higher than we expected. The net of we'll go to the agency staff on the next page, but we're about $1 million higher than we expected, and then about $1 million lower in revenue, which equals the about 2 million at the bottom that we're short. Operating expenses otherwise are pretty much in line with what we month to month and what we expect. Depreciation is being posted, and CIP expense was still going to be about $10,000 in some other minor equipment and improvements. So the total revenue year to date is almost 8 million. Expenses are 9 million for a loss of 1.2 before depreciation is taken out. About 1 million without depreciation. So this seems to be a little high yet if we're going to, well, July is halfway, so maybe we'll get to that. I don't think it'll end up being 2,147,000. I think with Fireside opening, it'll be more reasonable of a loss. Any questions on that so far?
Supervisor Bjork has one.
I don't want to be cruel, but how do you define reasonable loss?
When I said that, I knew that was a bad combination of words. Reasonable meaning that I think the projections are in line. As we work with Beata's financial worksheets, we keep tweaking and finding things that are not quite catching all the way as far as our projections and making sure everything's in the right category. So that's what I mean by reasonable, that we keep fine tuning, we keep going over the background calculations with a fine tooth comb.
So this is the first year that we have done this kind of projections, and it's a new spreadsheet. So we're finding things that we didn't think about or things that are not in the right place. So we're still getting used to the projections. So it's used as a tool to see where it might be, but it's not a definitive number of that's what it's actually going to be. So we anticipate it being lower than that.
But it is a scary number.
Yes.
Yep. So at this point in time, we are down $1 million. Again, there's a lot of moving parts here. Medicaid still hasn't finalized their rates for July of 2023. We did get finalized rates starting July of 2022 last month. We got that finalized, so that was a whole year behind. So there's some ups and downs with that. And in the future, they're going to I think overpay some of our claims and then want the money back in December. So it's hard to put a real bullseye on where we're going to land.
And I can speak to that a little now or later in the budget stuff, because it does affect this year's budget as well, or this year's financials and next year's budget. So because we operate on a calendar year for our fiscal year and the state does not, their fiscal year is different. When rates change, it is in July. So that their fiscal year starts in July. And how the rates are changing and what Jane mentioned of taking money back potentially in December is they gave us interim rates, and they are much higher than what we anticipate actual rates being. Just as a reference, the average interim rate was a 31% increase for all county homes in the state. We're not getting a 31% increase. That's just not realistic. We're hoping that it is still a significant increase, but we're just not holding our breaths that the interims will stick. So that's what Jane was talking about, of potentially overpaying our claims until we get that finalized rate, which last year it took an entire year. But we also didn't have interim rates until December last year for July. So they're roughly 6 months ahead of where they were last year. So we're hoping we get those finalized rates before the end of the year so that we know where we actually are at year end.
That is right.
So if 31%, let's just say even if it's 20%, does that mean starting with what the rate was like in July 1, we would be charging 20% more for all Medicaid?
Correct.
Yep, and then they'll take it back and
No,
It'll-
he's talking if
Yeah,
we,
I
if the
just-
final rate ends up at 20.
For example, yeah, it's just for example, because that seems large.
Yes, it is.
And is that because of the state budget or, okay, that's the
Correct.
state budget.
So at the state budget this year, they did change nursing home payment model, which is a really good thing. In past years, as you've all seen on our legislative agenda, is we've been arguing for an increase. Basically, every single year we've been asking, can we have a percentage increase? Can we have a percentage increase? And then in recent years, we've asked, can we have a payment standard so that we don't have to continually ask year after year after year, can we have an increase? Can we just have it be, this is the structure, and that there's sustainable increases so that budgeting is easier, in theory, and that we'll know that there'll be increases. So that's what they did this year is they created a payment model for the state biannual budget. And it is the median plus 25%. So basically a median nursing home and then tack on a percentage to that. So that's why there's such high increases. The reason for the interim rate is because they are not done with cost reports yet. So they don't know what that median is to then add the percent to. So once they know what that median is, then they'll add the percent and then we'll get our finalized rates. So they're just guessing right now on those interim rates.
So the state budget did set up a structure then,
Yes,
and it wouldn't be this much every year.
I mean, it depends on how things change. It would be based on the median cost.
Okay,
So
so if the cost went up due to cost of living, that's gonna go up. Okay.
correct.
And if it doesn't go up, it might not go up much.
Mhm.
Okay. Something to consider. Okay, thank you.
It'll at least be a better, instead of just waiting to see. So we'll have a better idea going in what it is. And right now, they're just trying to catch everybody up, I think, is what the main process of this is because we were so underpaid for so long of the increase and then making it sustainable going forward instead of just the yo-yo effect of getting so far behind, having large increases. This should just be more of a steady increase then.
Thank you. Any further before Jane goes on? Okay, Jane, looks like you got
Okay,
more for
there's
us?
one more thing to say about those Medicaid rates. If they pay us more upfront on every monthly payment, we are apt to get maybe a little bit less in the supplemental payment because if they're making us whole on the front end, there's nothing left on the back end. But hopefully our costs are still fully funded either way is what the goal is. So either on the front end or through supplemental payment, we hope to be made whole either way.
And it'll be either way better than this past year because part of the issue was our rates did not go up how they were supposed to. And then our supplemental also got cut because of how the methods changed. So hopefully that isn't an issue going forward. But this past year, we kind of lost it on both ends between our rates not going up as much as other places due to some cost reporting things and then supplemental payments went down across the board. So hopefully that is fixed and that's something we'll talk a little bit more during budget stuff because they have changed the process for supplemental payments as of last week.
Carmen is on so many committees that she is very, very up to date on what's being discussed at the state level. So we're glad to have that happening. Okay, without any more questions, we'll continue on with the financials. And there's the cents, there's the bar graphs again, and we'll make this look right. Where do I turn this around? Oh, it should be up here. View. Okay, view. Okay. Okay. We have the agency staff financial report. We've got a lot going on in CNA in the totals. The year-to-date actuals here is East has $1 million in CNA. Central has their highest expense in CNAs, and West has their biggest expense in CNAs. So that's where we get the most cost. The projections will of course change with the new hires that we have. So that's again very fluid, but we're projecting off of what we have. So right now, year to date, we've spent $3 million on agency staff. Total staffing with Dunn County staff within the nursing department is $6 million. And we project that to be 10 million for nursing overall. Any questions?
Doesn't look like it, Jane.
Okay. Senior meals is still healthy with the revenues and expenses. And depreciation did not get put in here for June and July. When I ran the report, it was not quite, it wasn't finished running. So that should be updated next month. And that concludes the financial report.
Okay, then I guess she's explained. We've asked our questions. Take a motion to accept the vouchers and financial reports. Supervisor Witzel moved, and the only other person left here, except me, Supervisor Bjork, seconds. All in favor? Aye, okay, it passes, they're accepted. Okay, we're on to number 9 now. It's that time of year. Getting ready for, is it next Wednesday, I think? Considerations of actions to be brought by the county board, approval of the Neighbors of Dunn County 2024 budget request.
All right.
And that would be Carmen.
Yes. So I think Jane's pulling up. Can you make that a little bigger, Jane?
Okay, you can still see that. Okay,
We can see it.
I took my picture off and I wasn't sure if it was all going to disappear.
That's perfect. Thank you. Okay. So we'll start with just the program overview or the program summary, and then kind of go into more specifics. And then if there are questions, we can go more line item too, and talk about kind of the first things that are what changes. So we did not make any changes in personnel. So we didn't have any personnel requests. We really didn't make changes in the operating budget besides accounting for inflation. The main thing would be our food costs have gone up for inflation, and then as well as things like medical supplies. So that was a couple of our bigger changes when it came to actual operating costs. The biggest change that we did this year, which we have talked about in past meetings, was what we were going to budget for census, so open households, things like that. So that affected our overall budget, both for revenue and then also expenses projections. And so we, as you're aware, we budgeted to have one household closed. So in the past, we've had the full campus open in terms of budget, and then basically gone off of, are we maintaining expenses to our revenues based on what actually was full. This year, we adjusted everything to having one household closed. That would be one of the central households, having the east and west buildings completely open. We also worked into here any sort of revenue changes that we can know of at this point. So that includes the increase in private pay that we discussed a couple of meetings ago, as well as the increase in rates from the state. That being said, as we kind of already talked about, we do not know exactly what they will be. So we did do a conservative increase on those. We definitely did not put 30% in there. But we are hoping that those are actually increase more than what we projected, and because we did keep it conservative and wanted it to be more realistic, kind of budgeting for the worst case scenario and hoping for the best at this point for those rates that we have in there. The other thing that is kind of a question mark is the supplemental payment, which we've talked about a little bit. We have a budgeted number in there. It has been very variable over the past couple of years. And when we went back and forth on how best to budget our supplemental payment, as in theory, we could look at an average of what we've gotten in the past, or look at trends of how it's gone down kind of steadily based on rates going up. The goal of supplemental payment is to supplement the losses for county and municipal owned nursing homes for Medicaid. So it's in theory should be higher the more Medicaid days you have. And then also if you have a more significant loss specifically for Medicaid. So in theory, if rates go up and cover more of that loss, the supplemental payment would then subsequently go down as it is intended to just make up that loss. So as Jane had mentioned, different committees and things, the Wisconsin County Homes Association has been working specifically about supplemental payment extensively over the past year. There was lots of questions about last year's, as the methods seemed to be different than in past, and there were big winners and big losers in terms of counties. Some counties made significantly more in supplemental payment than they were projecting, and many counties made less. And we were one of the counties that made less. So we're working on getting that more of a standard thing that we can project, which the state has been trying to be helpful too with working with WAC and at least giving WAC some options of how best to handle that going forward. There's also a lot of other statutorial rules about it. One of which is that we cannot be paid more than what we would have been paid if it was paid by Medicare, which is confusing. But basically they cannot give us more money than what Medicare would have paid us for a Medicaid person, because some of that money is federal dollars, and that is how that is written in there. So supplemental payment is definitely a question mark going forward as well. So you can see here on this summary, we break it down into skilled nursing and staff. The cost of staffing is a big part of it. And then operations is also in there. So that is the expense for operations. And then we also have dietary in there. So that's a separate expense. We pull that out because it is different. And that does include senior meals and, well, for the ADRC. And then we have ancillary charges that are lower. So that would be pharmacy, oxygen, transportation, any other services like social services, activities, therapies, and physician services. If you look over on the right, there's FTEs. We did not increase any of our FTEs. Another change that we did this year to try to make it more specific, about probably 3 years ago, we went from using the standard PEP spreadsheet that the rest of the county uses. We switched it to more of a fluid lump sum spreadsheet. With our level of turnover in our industry, it is very hard to use the standard spreadsheet. So in a smaller department, say a staff of 5 people in one of the smaller county departments, it's easier to budget for those specific 5 people. And then if someone leaves, you fill in that spot. When we have 160 people, it's a little hard to keep up with who filled in what spot in what way and how much do they cost versus someone else. So a few years ago, we went to using just an average and a lump sum. This year, because we did look at not budgeting full. We wanted to see actual numbers. So we went back to the actual PEP spreadsheet. So cleaned up the FTE situation, but there is no added FTEs either. So that's a general overview of the process we went through. We also went for all of the different departments. We went through a exercise we do every year, the neighbors department head. So, for example, Laura for social services, or Sarah for nursing. We go through line by line on every single cost center and every single GL code, and see, do we expect it to go up? Are we spending more here? Are we spending less here? Things like facilities, we go through that on tools, we go through on gas, we go through on every single thing that we use, and line item by line item, look at how much we've used so far, how much we can project to use by the end of the year. Is it going to go up? Is it going to go down? And that's how we arrive at the expenses for all of those items. Any questions thus far before I keep going?
Yeah,
If I could add one thing first, that these numbers, when we published this sheet, it showed a 4% increase in staff, and that has been updated to a 2% increase. So you'll see some adjustments in your meeting next week.
couple of quick ones. Did we go with 10% for the private pay increase?
I think it was 9.5.
9.5, okay. And
So,
what
'cause
did you go, I don't need the
Yeah.
details there. And what did you go with for your estimate for the Medicaid increase? Not 31, obviously. What'd you
No.
use?
Jane, do you have the specific numbers? I believe it was different per building.
We budgeted per building, and the average Medicare increase we put at 3.7%. Medicaid, I think we put at 3.7 again. Just to follow that, because we really didn't know what we were looking at. And they did raise, the rates in Central. Each building has their own rate chart. So the average increase was hard to base that off of as well. We did get increases in 22, so the increase for 20 or in 22 to 23. So to look at that 24 increase, we kept that at 3.7% as well.
Okay, versus could be much larger.
Correct.
Okay. Okay, thank you. Yeah, the real details part is more confusing, actually.
Yes.
But the bigger picture. So the bigger picture here is if we were budgeting as if we had the entire nursing home open, all 9 households
In the past,
in the
yes.
past. So now when we budget for 8,
Mhm.
except for inflation or whatever, we should have lower expenses budgeted.
In theory.
True.
In
It-
theory, yes, okay.
Well, true,
Yeah,
we did,
that's all.
we
Wait,
did.
Wait, Jane, just
Oh,
just
go
wait a
ahead.
second. I just want the big picture here first, then you can fill in the parts. So let me think where I was going here now. So in theory, the expenses are less. And the income would be less projected also, as if we were projecting all 9.
Without the increases, yes.
Okay. So it's really the same as before, except instead of 9 households open, we're looking at 8. Everything kind of balances out.
Correct.
Okay.
Yeah, we
That's all
did
I need.
scale. Yeah, we scaled back the dietary and the medical costs and some other things too that were directly impacted by the census.
All in proportion though.
Yes.
Absolutely.
I think the other 2 pieces, though, that are important are your staffing, your outside staffing costs are coming down. And your rates are going up.
Just for people that may watch this, Chris Coppola mentioned that our rates are going up and our outside staffing costs will be going down.
Mhm.
Did you get that?
Yeah.
Okay.
As a trend for right now. So,
As a hopeful trend.
yes, and we, so as, Chris Anderson had mentioned with our hires, we have in the past 2 months, hired lots I mean, lots is a general term, but a lot more staff than we have in recent months of internal staff. There was 2 weeks in a row that we had 4 internal employees in orientation. We had someone in orientation today. So it's been a good few months of hiring, and we hope that that continues, especially as there are lowering options of nursing home work in our area. I mean, we don't like seeing other nursing homes close, as there is a need for nursing home beds. That's a drastic need for our community as well as for our country. Nursing home beds are closing at a rapid pace, and our population is aging at a rapid pace. But we have been fortunate that we have gotten some staff from those places. Unfortunately, the reason most places are closing is because they don't have staff. So it's not an influx of a full nursing home staff coming to another one. But we have been fortunate to get a few people from each closure.
Were those the days that someone saw you doing backflips when we had all those good staff?
Yeah.
hired?
I
Yeah.
was like, I wish I could do a backflip.
Okay.
Yes,
Okay. So, yeah.
orientation is always a very happy day.
Okay. So what's up next?
Okay, you can see I have a general description. It kind of lays out the same thing that I just said, talking about increases in reimbursement, as well as that we've kept everything pretty status quo in terms of cost and tried to minimize as much cost as possible. We had a minimal expenses for capital improvement. That is primarily our biggest expense on our capital improvement plan in past years has been the bus. We are hoping to purchase the bus by the end of this fiscal year. So that will no longer be on the capital improvement plan. It has been on there in the past, and then we have not actually used it. So it doesn't hit the finalized financial reports, but it does show up on the budget most times. And as Jane had mentioned, there are things in this that will have since changed from when this was published to what you'll see next week. One of which being the grid increase for internal staff has changed at an overall county level. So that was not reflected in this number as well. So that expense cost will go down.
So explain to me, please, 2023 budget tax levy, 265,000. So that's what the neighbors got from tax levy last year?
No, so that was a projected loss for this year.
Wait, now, so the parentheses this time are lost?
No, that's the projected gain. Sorry. Revenues, parentheses in this time are not losses.
Okay.
So if you see revenues from last year or this year are projected to be 15 million roughly, and then 14,792,000 was the total funding, and then the expenses down below. So that would be projected revenue ahead of budget, or in the black.
Okay, but what's the tax levy line mean then? That's the one I'm asking about.
That's, Carmen, I believe that was a projected need of tax levy. That was the budgeted projected need from tax levy to make our budget balance.
Okay, so last year it was 265,000. I'm sorry, not last year, this year, 2023 budget. We budgeted that? I guess I didn't remember that.
Yep, that's what
Okay.
Beata came up with these numbers. Yep.
Okay, and we have been pulling money out of the fund balance, which, is that what you mean by levy?
So yeah, what's on there as a levy would be any projected loss. So that's just this form is not adjusted to us necessarily. So that would be, so this form is the standard for the overall county. So every department fills this out. And tax levy would be what any other department requests for. It's not we don't tax that on top of it. That would be fund balance money is what would.
Oh, okay.
It's just a standard spreadsheet that every department fills out.
Okay. I'm looking at our $2 million projected loss that we just looked at.
Mhm.
And here it says 2023, we're only gonna ask the county for 265,000. I don't get the,
That was the
budget
budgeted amount, the budget when we submitted it.
last year.
so, okay. Thank you very much. So this coming year, we would be, I won't use the word reasonable, but, 500,000 sure sounds better than 2 million.
Correct.
And I think 500,000 is what, was given, or not given, used over several years, or close to it.
Mhm.
Okay, all the revenues. So the projected expenses in 2023 are less than, no, I see it's 15. No, that makes sense then. Okay,
Mhm.
thank you.
Mhm.
I'm done for now.
Okay.
And
Any
part of the actuals that change is like the capital costs in 23, that would include the bus. But we're not doing some other capital improvements. So in actuality, our capital costs won't be that high.
And our capital costs come out of our budget.
Correct.
Yeah.
Yep. So we still do the capital workshop and do all of that and for planning for capital, but it is not on top, it's not part of the actual county's capital improvement plan. It would come out of our actual budget.
Okay.
Mhm.
So what's next?
Okay, if there's more specific questions, Jane, if you could go to that one, I guess we can start. We can look at each place, each building separately if you would like us to go into that much detail. So this is what the spreadsheets look like for each individual line item for each building and each cost center. So it shows what we are budgeting, what any increases would be or decreases if there were any, what we're changing for each section. So would you like us to go through each line item?
I first have a question,
Mhm.
and I have to say once again that I did not see any of this because I didn't catch it in my email. But was that sent to us also?
Yes.
Okay. And that looks very familiar from the PRD meeting.
Yes.
All the yellow.
Oh, go ahead.
See any of it either. I didn't have any of it. In fact, I didn't even see the employment activity or anything on mine.
Well, I see financials, I see Neighbors West. I don't see that one anywhere
I
here.
believe it's on one of those when you click on it.
Which one?
I don't know off the top of my head.
Neighbors West, Neighbors Central.
Yeah, so those are each buildings. So if you, that's a full spreadsheet that has.
Okay,
scroll
10
down,
pages.
yeah.
Okay, gotcha.
So it was, yep, so this is, each building has a separate spreadsheet that has, because we do budget them independently, and then that overall
Okay.
sheet you saw was all of them together.
So just so you don't have to go into too many details, if you've got it highlighted, is there a reason why some are highlighted and
Yes.
some?
So Jane, can you speak to the ones that are highlighted?
And you don't have to explain each one, just why did you highlight them?
They are highlighted because they're not automatically dumped into the spreadsheet from somewhere else. These are the ones that Carmen and I and Beata worked on manually and actually looked at the numbers versus maintenance contracts for IT. That comes from IT. They have a spreadsheet. It automatically loads into here. We can't change that. That's what IT is telling us our expense is going to be.
So that one wouldn't be highlighted.
Right.
Okay.
And all of the payroll that comes from that payroll, the PEP sheet. And so if something changes on the PEP sheet, let's say the potential increase in healthcare is 5 cents per person per month, that'll be coded into that and it'll dump right into our health insurance expense. So globally it's done and not
Sure.
individually.
Well,
Yeah.
the two separate ones, you guys worked on them separately, and the yellow and the other ones, they get
Mhm.
dumped in.
Correct.
Okay, now, do either of you have any particular ones that you'd like to bring to our attention that are considerably different, or there's an increase or a decrease?
The main ones are what we have already kind of discussed, so we can look into, agency staffing is always a big one. So we worked on that. And then, things like the food cost did go up significantly. That is by inflation. We worked with our food reps on that to see what the current inflation rate was, which was about 8% for food. So we did make sure to raise that up. And then anything that was census driven. So we did make sure that we were basing this based on the census on anything that would not be a fixed cost, food, medical supplies, things like that. So all of those were adjusted accordingly to both inflation as well as census. So those
Okay.
are things that went up and down, depending.
You mentioned staff and I
Mhm.
see RN pool help goes way down.
So that was,
And also LPN pool help, and of course, CNA goes up.
yep.
Yeah, okay.
CNA has been our main, we're basing that off of what we have currently used. We have had nurses, but we have had a lot of CNA. That CNA pool help there, I believe is, if I'm looking at that correctly, that is our cost center for, oh no, that's right. So that we've worked on changing some names because we currently have two things that say pool. So RN, CNA, LPN pool up above is actually our like people picking up a shift, either voluntary or mandatory. If
Mhm.
it says pool help, that is our agency staff. So we've actually changed that going forward, that those will say agency, because we have multiple things called pool. But we've based that on the fact that our CNA is where the majority of our cost for pool help comes from. We do have some nurses on and off, but it is primarily CNAs, even though they are less costly per person, we just have more of them. Another change that you can see there is we have moved things around a little bit. Office supplies was something we moved. So if you notice, office supplies in all the other departments has gone down to 0. And then we've just put it all into NDC admin because we were breaking it out before and it didn't make a lot of sense. It all comes out of the same budget in the end. So we just did all office supplies in the admin cost center. So those are changes you'll see across the board. The admin one got significantly bigger and all the other ones were zeroed out. So those come out to a net 0 for an increase. But things like that, we moved around to make sure that they were being accounted for appropriately, because when someone goes to the storage unit and grabs pens, they don't necessarily
Yeah.
write what department they're from and things
I'd
like
fire
that.
them. No. And just for a couple little things, I'm looking at ones that are a lot different,
Mhm.
like Medicare Part A for the pharmacy. And it's scrolling down to the pharmacy. It goes from 13,000 to almost 60,000. And I'm where you told me.
Pharmacy.
No, I've lost it.
I've lost it here. Here we go.
All right, there. It says $35 a day times, et cetera, but I'm just curious. I kind of like. Is
Uh,
that okay?
Yeah, in the end, the pharmacy cost overall is actually higher than what we were budgeting. So I looked at how much it was per person per day and multiplied it by the number of days we're projecting to get a much more accurate
Okay.
estimation of reality. If we're going to have more Medicare people, we should be budgeting more of their pharmacy expense based on the census. And based on history, that's what we should be budgeting.
And it's all in yellow, so these are things that you all
Mhm.
went and looked at.
Yep.
Yeah.
So aspirin and Tylenol and those little things averaged 45 cents per resident per day. I have a typo there. And times all the residents for pharmacy, that's what we spend for those smaller things. Yep.
Is there anything else either one of you wants to mention in particular that we should know or that you find interesting, or is it an anomaly?
I think these are much more accurate estimations of our expenses. You'll see an updated version coming with, like I said, the lesser increase in personnel. And we also updated Central's expenses in the pharmacy, lab, oxygen, all of these direct care categories. That hadn't been done. I was out on a medical leave and didn't get the Central part fine-tuned. So that has been done now that I'm back, and you'll see the difference. The increase in Central's budget isn't going to have as much impact with the lower personnel charges.
Yeah.
So that's a change. You'll see these have been updated. And if we go to Central, like to this campus summary, you'll see the total. We've got East, Central, and West here. And proposed change is only 2.12% here. And I'm not sure if this is the updated one. I think it is the updated one that came into your packet. Do you guys show in your packet the 2.12%
Yes.
change?
The
Okay.
printed packet, yeah, so this is the one that came out. The printed packets that I had are the 1.44% change.
Mm.
So that it's the updated after the changes that Jane has made since the original packet went out.
And we also, the other change was the East and West charges for personnel were off balance for East and West when you consider that they had about the same amount of residents, then they should have about the same amount of staffing. So we made that reconciliation as well between the two buildings. But overall, we're at a 1.44. Unless they change something else between now and next week. And when things come in, health insurance estimates, FICA tax, those things that aren't really within our control, those will be adjusted as well.
Okay. Supervisor Bjork, Supervisor Witzel, you have comments, questions? Anything? Use your,
So whatever's highlighted on this campus summary will be proposed next week at our county board.
So the county board budget workshop has a bit of a different structure. I believe that, so the overall county budget will be brought up as a whole, which does include us. But I believe the more of that will be focused on things that can change tax levy and what gets distributed out to each department. Our budget does not go directly affect the tax levy on the upfront because we don't get tax dollars in directly. It would be general fund later on, potentially, depending on the outcome of the year. So this will not be itemized out like some other departments might be.
Okay, thanks.
but it's not just the yellow.
Right.
Yeah.
Yeah.
Is that it then, Jane?
Mhm.
Carmen? And
That is all I have. Yeah.
it says actions to be brought to the county board, approval of the budget. Well, we're gonna send it on to the county board?
I think so.
I think it's a motion.
I motion to send it on to the county board.
And Supervisor Witzel seconds. All in favor? Aye. It's approved to go on the county board. And there's one announcement. Carmen is doing a CVLR, Chippewa Valley Learning
Oh, yes.
Retirement
It's like, what?
program in September, I think.
Yes.
And I think that's great PR.
Yep.
That's great PR. I don't know if you're familiar with it, but so should we check that out in your booklet?
Yeah, I will be doing just a general, they asked me to give a talk about a general state of nursing homes, what to expect about nursing homes, how it's going. Try my best not to get too far into the weeds, and have people check out a little bit, but just kind of going over what's going on in long-term care and changes that have occurred.
Yeah. So, and
It's in September. I'll pull up my calendar in case I say the wrong date.
well, we're gonna need it for the next meeting time anyway.
Yes. The next NDC meeting is on the 28th of September, and the Chippewa Valley Learning is the day before, the 27th. Perfect.
It's a great program for
anyone. Okay.
I've never heard of it before.
So any other business that we have forgotten? Then we are adjourned.
The 28th of September at 9 a.m.